Good morning. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health and also the Oklahoma University Chief COVID Officer. I'm going to start off today by just going through a very brief review of the current data for Oklahoma, since I think most are aware that we're doing very well. I have provided a handout, and after I go through some of our current data, I'm going to talk about some of the things that have hit the medical news this past week, and I've provided references that you can use. So we're doing really well in Oklahoma right now. Right now we're at about 6 cases per 100,000 population per day, which is a tremendous drop from mid-January. In fact, we're seeing the numbers come down across the entire country. One of the things I've been watching is Michigan, that just a couple of weeks ago was at around 79 new cases per 100,000 population per day. Today they're down to 34. So we're seeing the number of cases come down across the country, though there are a few hot spots that have developed. Right now in Oklahoma, we're sitting at just under 450,000 confirmed cases in the state, with just over 8,300 people who have lost their life. I do highlight one of the slides I present are the 7-day rolling average. We're at 232 new cases per day right now, and if you look, the 7-day rolling average is completely flat. It has not been dropping for the past 2 weeks. So we very much plateaued. We're seeing about 1,600 Oklahomans that are newly diagnosed with COVID-19 each week in our state. Oklahoma, Tulsa, and Cleveland County continue to have the most cases, but they too are doing very well from a population perspective, having only 6 to 7 new cases per 100,000 per day. So we're much better place in the entire state than we were just a few weeks ago. Testing is way down. The state health department announced this week that they will no longer be releasing the executive order reports, so I'm not sure how we'll know the percent of tests that are done that are positive, but testing is way down compared to where it was just a few months ago. And the good news also is that hospitalizations are down. On average, we're seeing about 170 to 180 Oklahomans that are in the hospital each day right now with COVID-19, and about a third of those people end up in the intensive care unit. So clearly we've come a long ways. The cases are way down, but I want to highlight that 1,600 Oklahomans are newly infected each week. This is not completely over yet. I sent out several handouts about some of the key points that were in the medical news, and one that caught my attention yesterday was originally published in Kaiser Health News, and it simply showed that more and more hospitals around the country are seeing the demographics of COVID patients changing. Originally, early in the pandemic, it was primarily the elderly, and age is the biggest predictor of complications, hospitalization, and death. However, what hospitals around the country are seeing now is increasing numbers of young people who are being hospitalized in that 30, 40, 50-year-old age group that aren't as vaccinated as the elderly, but are still getting COVID-19. And in fact, this week, the American Academy of Pediatrics put out a paper that basically showed that 22% of the people in the hospital or the new cases, 22% of the new cases of COVID-19 for the last part of May. I told you this is going to be a tough day. So 22% of the new cases during the last weeks of April were children. So we're seeing a change in the demographics of the disease. It is still spreading in young children. We know that the UK variant is the most predominant variant in the United States, and it does seem to spread easily amongst children. That has real implications as we start to think about vaccinating young people in the very near future, because that is a group that's likely to be infected and they can spread the disease. And I've highlighted several different slides on Oklahoma data that show that the biggest driver of new cases in Oklahoma have been that 15 to 24 and 25 to 34-year-old age group. If you look at data now since the start of the pandemic, that is the group that's had the most cases in Oklahoma, and that's important. I often call that younger population the engine of the pandemic. They're out there social, they get infected, they usually do very well. Most of them don't end up in the hospital. Most of them don't have complications, but they spread it to older people. So again, we have to remember the pandemic is not completely over. In fact, if you look in Oklahoma, 1/3 of all the cases in the state that have been diagnosed up until now are in that 15 to 34-year-old age group. So that is a young group that we need to really focus on improving vaccination. In fact, if you look at Oklahoma vaccination data, only about 18% of those people from the ages of 18 to 35 have received, are fully vaccinated, and only 8% of that 16 to 17-year-old age group are vaccinated. So it's a group that we really need to focus on because they get commonly infected, they spread it easily, but they haven't been vaccinated. Of course, it's likely that we will see at least one of the vaccines approved for 12 to 15-year-olds in the very near future. So we have a lot of work to do on getting people vaccinated. A couple other things I noticed in the medical literature this week were some very good studies that focused on some of the risk factors for COVID-19. One was a very, very large study that came out of the United Kingdom. It was a study of 6.9 million people, and they looked at the impact of obesity on the outcomes of COVID-19. And across the board, they found a linear relationship that the more obese a person is, and they used a cutoff of 23 as a BMI, but if you are obese, your risk of hospitalization, complications, and death from COVID-19 are much greater. The CDC has showed the exact same thing in the United States. One of the biggest predictors of hospitalization from COVID-19 is obesity. And so we live in a state where we have relatively high rates of obesity, so we need to remember that we have a population of people that still have substantial risk from the complications of COVID-19. And then finally, I put in 2 studies that talk about some things that I've mentioned before, but I think are really important to reiterate. People who are sick, people who are immunocompromised, people who have had organ transplants, even if they're fully vaccinated, may not get good antibody responses and may not have protection from COVID-19. So I've been quite disturbed when I hear reports of people telling listeners to shame people that are wearing a mask in public or to ask them why they're doing it. And just remember, you do not know when you're in public if a person that you encounter may have an immunosuppressive condition, may have cancer, may have had an organ transplant, may be on immunotherapy for their underlying autoimmune disease. They are still potentially at risk of COVID-19, and I think it's very, very important that we recognize there are some people who are going to have continued risk, and I encourage you, if you're in a family with one of these persons, or if you're out in public, to continue to wear a mask as much as possible to help protect people from COVID-19. So I think those are the key points I wanted to make today, and I'm happy to answer questions.
I have a few questions, but I was thinking when you were giving those numbers, it seemed like I was trying to think of a year ago, because we were just really, so we were hit in March, and we just started gearing up, and we started hearing that the surge was coming, and I think we were expecting it kind of this time last year, maybe, as our, but still, you're saying we have 1,600 new cases a week in Oklahoma, is that right?
Yeah.
So how does that relate to a year ago? I mean, right now that seems, wow, finally we're down to that, but it seems like a year ago we were going, oh my gosh, we're at that 1,600. So I guess it's all, if you're perspective, if you're looking forward or looking backward.
Right, so the question really gets to your perspective on the number of new cases per day. So we're seeing about 1,600 new cases per week, 232 per day right now in Oklahoma, and that takes us back to where we were last June. Now remember, last June we were appalled that we were seeing 200 or more people get COVID-19 a day. And of course our perspective changed when in January we were seeing 4,000 people a day get COVID-19. So in perspective, we're not seeing nearly what we did in January and February of this year, but the reality is we're seeing numbers that we were seeing last June before we had some of the big increases in the number of cases. So I just highlighted to say that we've come a long ways and we're a lot better, but it's not over yet. 1,600 Oklahomans each week are still being newly diagnosed with COVID-19. I looked at Oklahoma County yesterday. Approximately 113 people in Oklahoma County are newly diagnosed with COVID-19 each day. So it's not gone, it's not over, and there are people still in the community, and that's why I highlight people in the community that are immunosuppressed, sick, have underlying conditions. They're still at risk to get the disease if they're not vaccinated, and even if they're vaccinated, some of those people will continue to have substantial risk.
Likely I saw this on something you posted, but it was the CDC kind of illustrating how safe certain things are. So if you were outside with a group of people who have been vaccinated, extremely safe. You probably didn't need masks. You didn't need masks, I think they were saying. So can you just give us a little bit of an overview of what the CDC is saying is safe right now without, where you can actually safely not wear a mask and where you still should wear a mask?
Yeah, so the Centers for Disease Control came out with new masking guidelines for people who are fully vaccinated. And as we've talked about many times before, outdoor activities are much safer than indoor activities. When you get groups of people indoors in settings where they don't wear a mask, the risk of transmission of the virus is still much greater. Remember, the majority of Oklahomans are not yet fully vaccinated. So there are a lot of people in the community that haven't had both doses of the vaccine or haven't had any vaccine at all. So if you're in an indoor setting where people have their mask off, talking, singing, yelling at a sporting event or anything like that, you substantially increase the risk of transmission of the virus. Outdoor activities in general are much, much safer, and CDC has basically said that if you're fully vaccinated, in most outdoor activities, particularly if you're not in a really big crowd, that you can safely take your mask off and not worry. You don't get this virus typically by casually walking by somebody outdoors. That's not how you get this disease. We know that the majority of transmission occurs in indoor settings, and so outdoor is going to be always safer. Now, they put the explicit caveat that if you're not vaccinated and you're around other people, you should still wear a mask. And they also note that whether you're vaccinated or not, large sporting events where you have lots of people close together, yelling, not wearing masks particularly, would substantially increase your risk. So it's important to wear a mask in that setting.
All right, a couple questions here. Are there enough people vaccinated for the activities going on? And this is specifically to Tulsa, but you were just, it's anywhere, and you're saying like sporting events, Cinco de Mayo, et cetera, to be considered safe. So really you've just answered that, but is there anything else you want to add to that?
Yeah, so the question largely came from Tulsa was about, are enough people vaccinated to make it safe to do some of these activities, these larger scale activities like Cinco de Mayo, sporting events, and others? Again, I think the big metric here is, number one, how big is it? If it's a big sporting event, but you got a lot of people in the stands close together, then there's still risk of transmission of the virus. If it's an indoor event, clearly there's still risk of transmission of the virus, because we know that the virus gets in the air, can hang around in the air for periods of time. A very nice study from MIT that came out just recently showed that one of the best ways to transmit droplets out of your mouth is singing. So if you have groups of people indoors singing, a lot of droplets and aerosols come out of your mouth. So indoor activities are always going to be greater risk than activities outdoors. But if most people are vaccinated, I think in outdoor settings, most of the activities are reasonably safe. I do again highlight, though, that if you're immunosuppressed or if you're around people and you don't know, wearing a mask is the safest thing to do.
Do loosening restrictions and increased big events pose any future threat for the state in terms of surges or rising cases?
So the question is, if we continue to loosen our mitigation, like wearing masks, social distancing, and we have big events where people are coming together, does that increase the risk of a potential surge? I don't know if we're going to see big surges again. What I do worry about, though, is that we'll see local outbreaks. So there are two things going forward I think we have to think about. Number one, what proportion of our population will ultimately get vaccinated? Because to achieve that mythical herd immunity, we need to get up to 70, 80% perhaps or more fully vaccinated. We know a lot of people have had COVID-19, but we don't know how long that protection will last once you've been infected. Secondly, there are a lot of researchers who are concerned that COVID-19, the virus that causes COVID-19, may be seasonal, just like the flu. So we may be very comfortable because cases are dropping now. It's spring, summer, people are outside doing activities. But in the fall and winter, when people start coming back inside, will we see seasonality of the virus? In other words, will we see an uptick or a surge in cases because of seasonality of the virus? And there, I think our big risk is that if we have large numbers of people who aren't vaccinated, particularly when they come back indoors, then I think we could see local outbreaks occur with the disease.
This just came in from Dana with the Oklahoma, and she was asking, how will vaccines being available to kids ages 12 to 15 help the efforts to get to that herd immunity?
Yeah, so the question is about how will vaccinating kids help us to get to herd immunity? So I think that's part of the reason I highlighted in the graphics that I sent out that it is that younger age group that are truly the engine of the pandemic. They're most likely to be infected. Again, very luckily, they don't get nearly as sick, but they spread the disease. They can give it to adults, to their caregivers, to their teachers, to other people. And so I think it's incredibly important that we get young people vaccinated. One point I do want to make is that if you look just at college-age students in the United States, I just noticed yesterday that data shows that just a little over 2,000 college-age students during the pandemic to date have died from the disease. It's not common, but it does occur. So I think we cannot let our guard down with respect to young people getting the infection because they can have complications of the disease.
So I saw something just maybe this morning about so many people not getting their second dose for one thing, and then somebody posted or somebody was commenting that if you get your second dose with a different vaccine, that actually that was giving you more coverage. So can you address that?
Yeah, so the first point is it's about whether people are getting their second dose of the vaccine or not. So we know that 10% of people who get the first dose don't necessarily go on and complete the second dose of the vaccine. And I think part of that was self-inflicted by the healthcare system early in the pandemic because we would give a first dose, but then the patient had to go out and find the second dose. Most people now that are giving one of the RNA vaccines schedule the second dose when they give the first dose, which I think helps. But some people don't get the second dose. So, for instance, if you look at the Pfizer or Moderna vaccines, we know after the first dose, you get about 80% protection. That's boosted up to 94, 95%, perhaps even higher after the second dose. So the second dose is very important. And so I've highlighted in several interviews this past week that although the CDC recommends that you get the second dose within 6 weeks of the first dose, there is no maximum interval. If you've had the first dose, please seek out the second dose. Boost your immune system. And then to the second point that you made, there has been a couple of reports of studies that are trying to assess that if you get one of the vaccines, let's say you get Pfizer, and next time you get Moderna or you get Johnson & Johnson or in the near future perhaps Novavax, does that boost your immune system and give you better protection against variant strains? We don't know yet. That data are all very, very preliminary. And I think Moderna has already posted data that suggests that a third shot may give you additional protection down the road. And so we don't know yet whether boosters are going to be recommended down the road.
I know you've talked about this a little bit already, well, quite a bit, but I just want to make sure we have some viewers that kind of have popped in a little bit late today. So if you could just, again, just go over the safety of live, specifically live music events, but I think the point is being group events, indoor versus outdoor, and what people should still be aware of.
Yeah, so again, the question is about indoor versus outdoor events. For instance, a concert. So I would say in general, people coming together outdoors, perhaps physically separated, perhaps on blankets like you would do at a picnic, separated families and things like that. Outdoors are probably pretty safe because we know the virus doesn't transmit easily outdoors. Part of that may be because of the wind. Part of it may be the fact that people are more separated when they do those types of activities. So if you're outdoors, now if you're in a packed stadium outdoors and you're packed together, you have definite risk of transmission of the virus, particularly if you like to sing along with the band and other things. Singing, any loud yelling increases the droplets that come out of your mouth. Indoor events, clearly you need to wear a mask. If you're in a tight indoor concert event, even if you're fully vaccinated, I put one study in that showed that reinfection does occur in fully vaccinated people. It's not common, but it does occur. Some people have died who have reinfection. And then again, just remember that there are a bunch of people in Oklahoma that have some underlying medical condition that even if they're fully vaccinated, they may not be completely protected.
Very good. I think that looks like that's all of our questions. There was, I saw that New Zealand, because they've, I guess, pretty much consider themselves totally eradicated of the disease, that they had the largest concert that has been held since COVID began, I guess, and recently. And how are they able to do something like that and not restart COVID?
Yeah, so the question is about a country like New Zealand that has largely eliminated COVID-19. They have their case counts so incredibly low that they're comfortable now opening up to full outdoor concert events and things like that where they bring people close together. And that's where we want to get to in Oklahoma. They did it through very, very strict public health measures. They did very aggressive case investigation, contact tracing, isolation when cases did occur to keep those from spreading. So they did that very aggressively. They shut down when they had cases. They shut down businesses and other things to slow cases. They've been very strict about people coming into the country from other countries to reduce that risk of transmission. So that's where we want to get to. If we get down our case counts down to 1 to 2 cases per 100,000 population, the risk of transmission from person to person goes down dramatically.
Anything you need to add?
I don't think so.
I will send out the slides